There are two procedures in which treatment is delivered directly to a liver tumor via its feeding arteries. They are known as chemoembolization, that uses chemotherapy beads, and radioembolization, also called Y90, that uses radiation beads. Both treatments prolong survival by shrinking the tumor, but in general do not cure liver cancer. Eventual recurrence is likely, and therefore patients require continued follow-up with a hepatologist to monitor for this, in which case repeat or alternate treatments can be considered. Chemoembolization and radioembolization are performed by interventional radiologists. During these procedures, the radiologist will access an artery in the groin or wrist and thread a catheter, a very small tube, through the blood vessels to reach the small arteries directly supplying nutrients and blood to the liver cancer. Chemotherapy or radiation beads are then injected into the tumor with the goal of killing the tumor cells. Multiple treatments may be required to control the cancer. Side effects of chemoembolization and radioembolization include abdominal pain, nausea and vomiting, flu-like illness such as fever and body aches, or less commonly, worsening of liver function. To reduce infection risk, antibiotics are prescribed after the treatment. A CT scan or MRI is performed after about 4 to 6 weeks to evaluate the response to the treatment. Each patient's case is reviewed in a multidisciplinary tumor board at CPMC to discuss the optimal treatment, considering the patient's liver function, overall health, and functional status, and the number and location of the tumors. These specifics help the team decide if chemoembolization or radioembolization is the best treatment option for you. One way that radioembolization differs from chemoembolization is that it requires 2 visits. The first is to localize the tumor and calculate your customized radiation dose, and the second is for the actual treatment delivery. These visits are usually separated by 1 week. The benefit of radioembolization is that it tends to delay the time to recurrence as compared to chemoembolization, although not all patients will be candidates. After receiving either chemoembolization or radioembolization, ongoing monitoring using scans and laboratory tests is important, with results reviewed by the specialized team at CPMC. If your treatment plans includes an interventional radiology procedure, we have some information for you on what to expect. We encourage you to schedule your procedure in a timely manner to allow optimal treatment outcomes. We recommend you arrange time to rest and recover in the several days following your procedure. The most common side effect is pain, which should decrease over time, although you might also experience nausea, reduced appetite, and loss of energy. Once our team has scheduled your procedure, we will reach out to you with some specific instructions. These instructions will include timing of blood tests to be drawn if recommended by your provider. Your medications will be reviewed, and you may be asked to stop taking any blood thinners or specific diabetes medications in the days leading up to your procedure. Otherwise, you should take your other medications the morning of the procedure. Aside from a small amount of water with medications, please don't eat or drink anything for 6 hours prior to your procedure. You will be asked to arrive in the pre-operative area 2 hours before your procedure is scheduled to start. When there, a nurse will help you get changed and settled in. Your belongings will be checked. An IV will be started, and any final tests, such as blood draw or EKG, will be performed at this time. You will meet the interventional radiology doctor, who will review the details of the procedure with you and answer any questions you may have. The procedure itself usually lasts about an hour and is performed either under anesthesia or sedation. Most patients can be sent home the same day after a 4-hour recovery period, although spending the night in the hospital is sometimes required. For some procedures, you'll receive medication prescriptions to take after your procedure. Instructions for taking them will be reviewed by your nurse before discharge. If you have any questions about medications when you get home, call your liver doctor. The good news is that there are no true incisions from the interventional radiology procedures, since they are minimally invasive procedures. You will just have a small dressing covering a pinpoint hole, which can be removed after 2 days. You can shower on the day after the procedure, although no bathing or swimming for a week. Also, avoid exerting yourself for 5 days. Depending on the type of procedure performed by interventional radiology, you may be required to have follow-up labs or radiology imaging. These will be arranged by the liver scheduling team. We've gone over a lot of material, and we know that you still may have some questions. Take some time to write down any questions that you may have, and don't hesitate to ask your doctor for more answers. Thank you for watching this video. We look forward to working with you and providing the support you need before, during, and after your treatment.